Hi, I'm naturopathic Dr. Christina, and on behalf of Health Buddha, I'd like to welcome all of you and thank you for joining us for our Lunch and Learn webinar today on PCOS and how it impacts fertility. Just before we get started, just a little reminder, if we can please make sure that your mics are on mute. And if you have any questions, please feel free to pop them into the chat and we'll be sure to address them at the end of our session today. Our guest is not only one of my colleagues, but someone who mentored me during my 4th year of naturopathic training. And so I am thrilled to introduce fertility-focused naturopathic Dr. Rachel Corradetti-Sargeant.
Hi, thanks for having me.
Thank you for being here. Before we jump into, such a loaded topic, I'd love if you could just share a little bit about yourself and what you do in your day-to-day practice as a naturopathic doctor.
Sure. So I have a very specific focus in fertility. I work with a group called Conceive Health, and we are entirely fertility focused. Each of us are placed within a fertility clinic associated with trio fertility centers. So I am part of the Niagara Fertility Group in Stony Creek. And so I work with patients within the Burlington, Niagara, Hamilton area primarily. And it's a pretty fantastic way to practice because we have a truly integrated model where we're working with the medical doctors, the reproductive endocrinologists, and the nurses to take care of fertility patients as they're going through diagnostic testing, cycle monitoring, and even through advanced reproductive techniques like IVF. So very rewarding focus overall. So my all day, every day is fertility.
Awesome. Well, I know you have a presentation set for us today, so I will hand over the floor and leave it to you.
Okay, great. So we'll circle back when it's question time. I'm going to hopefully make this work.
Perfect.
Excellent. Okay, so I won't go through much here since we've covered some of it, but just to introduce what we'll be covering today, we want to cover what is PCOS, why PCOS has an impact on fertility. I'll also address, can you conceive with PCOS? Because that seems to be a primary concern when I have patients who are in the office who are either newly diagnosed with PCOS or knew they already had it. Their main concern is, can I get pregnant? We'll talk about some management tools that we have for PCOS, and we'll also talk about where a fertility clinic might fit in, because in some cases, you may have to go that route depending on the severity of the situation. So we'll discuss the finer details of that. We won't go through me because we already talked about that, so I'll skip that. Let's jump right into what PCOS is. So PCOS stands for polycystic ovarian syndrome. In all honesty, I wish that we had a different name for this condition because I find it's very confusing for patients. Because the cystic presentation that we're seeing with PCOS isn't the same as, the cysts that we hear about when we're talking about like true ovarian cysts. So it tends to be a bit of a confusing name. The other thing that's confusing about PCOS is that you don't actually have to have cysts on your ovaries for you to be diagnosed with PCOS. So if you do have cysts on your ovaries, as I've shown here in the presentation, you'll see that with a normal ovary, we get this kind of lovely development of a follicle through to the point of full maturity and ovulation. In a polycystic ovary, you'll see that we get these follicles that are essentially stunted in their growth. So they're not able to proceed through to full ovulation. And so when we look at the diagnostic criteria for PCOS, we follow the Rotterdam criteria. And typically we need patients to have 2 out of 3 of these diagnostic criteria in order for them to have a true PCOS diagnosis. So yes, one possible piece of diagnostic criteria is the PCO appearance of the ovaries or the polycystic appearance of the ovaries. The other thing that we look for is elevated androgens. So androgens are essentially the male pattern hormones. As females, there are androgens present within the body, but they're typically in lower amounts than in male patients. We actually produce androgens within the ovaries as the follicle is going through its maturation process. However, if androgen levels become too high, it will actually stop the follicle maturation process. And we'll start to see in some cases clinical signs of androgen elevation as well as biochemical signs. So clinical signs will be the things that we can see. So I've gone through some of the signs here, but you'll see things like acne presenting on the face. You'll see things like body hair growth in places that we wouldn't typically expect it for a female. So it can be on the face, it can be on the chest, on the back, on the abdomen. We can also, in some cases, start to see areas of hair loss. And so typically that hair loss presentation would be presenting on a female in a way that we would typically start to see it in male pattern hair loss. So those are some of the clinical signs. Also, we can see elevated androgen levels on blood work in some cases. So part of my diagnostic workup for PCOS includes looking at androgens to see if we have elevated levels on blood work. The other sign that can come along with PCOS and is one of the diagnostic criteria pieces is full anovulation. So not actually getting to an ovulatory point in the cycle. And so that can make ovulation predictor kits really hard to use when you're trying to conceive. And it may also lead to irregular periods, skipped periods, and basically a bit of a hormonal mess there. Some of the other signs and symptoms that we often see with PCOS include patients presenting as overweight. We can also see insulin resistance on blood work, risk of diabetes, and darkening of the skin and skin tags. So those are some of the things that we'll see. So when we talk about PCOS management, thankfully, we have a lot of options that are available. I'll talk about where the fertility side of things comes in just a moment. But if we're talking about some of the things that we can be doing, outside of a fertility clinic, there are lots of options available to us. So with lifestyle modification, we can make huge amounts of change for PCOS patients. So some of these modifications include dietary modifications where we work on increasing fiber and increasing protein so that we can get better control of blood sugar overall. We'll also talk about incorporating exercise as a way to manage insulin resistance, manage blood sugar, of course, and then also to reduce weight. And we'll talk about the importance of stress management and the importance of sleep as well, because both of those can actually impact your insulin sensitivity and your insulin input. So I touched on this a little bit already, but insulin resistance is a very common piece of the PCOS puzzle. And that is basically a situation where, your body is producing insulin in order to keep your blood sugar levels under control, but you're not necessarily sensitive to the insulin. And unfortunately, that can result in, of course, your cell not being able to metabolically function properly. It can also cause issues with, your blood sugar levels actually starting to rise. And this will actually lead to a rise in those androgens that we talked about, those male pattern hormones that can really shut off ovulation. So there's lots that can be done. Of course, when you're working on lifestyle modifications, it's never easy and it takes time and it takes work, as well as accountability. And that's something that I certainly work hard with my patients. It's never just here, eat like this, see you later. We're often looking at blood work. We're checking in regularly to make sure that the applications are effective. There are definitely a lot of supplements that are out there for managing PCOS. If you ask Dr. Google, he'll give you a whole list of options. I'm always very surprised at some of the things my patients come in on. We have to be careful when it comes to supplementation because we want to be sure that you're using the right type of product. We want to make sure that you're using the right amount. We also want to make sure that you're using it for the right duration for it to affect change. Some of these things we also want to be mindful of when you're potentially using fertility medications. And so we talk about which options are safe when you're going through cycles and which aren't, and how to use them. So I give this list of supplements here, and it's not with the intention of you going out and purchasing all of them and getting started with them. Really, the recommendation is to speak with your healthcare provider so that you understand how to use these things, if they're appropriate for you, and for the use of these types of items to be monitored properly. So let's get to the nitty-gritty about the fertility side of things. So interestingly enough, 80% of anovulatory infertility cases are due to PCOS. So it's pretty staggering. And I can absolutely, relate to that number, because a large majority of the patients that I work with at Niagara Fertility have PCOS, a lot of them. And of course, the question that I am often asked by patients when they either, already know they have PCOS or find out through their workup at the fertility clinic that they have PCOS is, can I conceive? And the answer is yes, absolutely. And I've had patients who have PCOS conceive on their own without, having to go through cycle monitoring and medicated cycles and that type of thing at the fertility clinic. So it is a very manageable condition. If we're talking about what a fertility clinic will be doing to assist with conception when you do have PCOS, oftentimes we're using medications that will help you become more insulin sensitive. For example, metformin is often utilized, and also medications that can assist with ovulation and follicle development. So letrozole is very commonly used, medications like Ovidrel to help you ovulate, and oftentimes in the luteal phase, we'll use medications like progesterone to help with maintaining a pregnancy. So it's still very important to approach PCOS from an integrated place, because if you have PCOS and often, like I said, the insulin resistance that comes along with it, it's not really a condition that we treat it and off it goes, right? This is very much a lifestyle situation that we need to be managing long-term. And unfortunately, it can increase the risk of issues during a pregnancy. So you have a higher risk of gestational diabetes. There's a higher risk of placental development issues. We have a higher risk of conditions like preeclampsia. So we want to be sure that prior to conception, and ideally, a couple of months before conceiving, we are working on really improving your overall health so that you're healthy during your pregnancy. Some fertility medications can't override the severity of PCOS. I've certainly seen that quite a bit in the clinic where patients weren't, undergoing integrated care, and, their PCOS was so severe that the medications weren't even doing anything to help them. So when we started to bring in, things that were really assisting their metabolic function and reducing their androgens, we had these cases moving in the right direction. You also need to be aware that with PCOS, you have a higher risk of other metabolic conditions developing later on, type 2 diabetes, high cholesterol, high blood pressure, stroke, certain cancers. And so we want to ensure that not only are you healthy before conceiving, we want to make sure you're healthy while you're pregnant, and we want to make sure that you're healthy after you've delivered, because now we've brought this beautiful human into the world, and we want you to be alive and well while you are, raising your child. So in terms of next steps, if you're thinking that this might be you, like, do I have PCOS? Maybe you've been diagnosed with PCOS and you don't know what to do next. First of all, it's a good idea to keep track of your cycles so that we can understand what's going on. Having that type of data can be very helpful so that we can see change as we start to make modifications. There are other fertility signs that you can consider tracking, things like basal body temperature, ovulation predictor kits, cervical mucus, that's what CM stands for. These are certainly things to consider keeping an eye on and learning more about, but absolutely we want you to be using a good app to watch your cycles and keep an eye on the length. Kindara is one of my favorites. You might want to take a look at other possible signs that you could have. You heard me mention some of the classic signs of PCOS. Ask yourself, do I have these things? Maybe I do have PCOS, excuse me. And if that is the case, then you probably want to consider booking an appointment with your healthcare provider to discuss testing, blood work, imaging, the types of things that we can do to really have a clear understanding of whether or not you have PCOS. And then if for sure you do, or if you think you do and your healthcare provider is not helping you with this, then absolutely working with a fertility-focused ND, of course, if your end game is to conceive, can be very helpful for you to understand exactly how to manage PCOS in order to achieve your goal. So a couple of resources here. I have a couple of books listed on the side that are great resources. My information is included there as well as references. And this is probably a good time to stop and answer any questions that have come up. Christina, do you want me to stop my share? Oh, you're muted.
Sorry, I was muted. Yeah, you can stop sharing. Okay. I was just there's no questions that came in, but okay. One of the things that I think is so key that you mentioned is just how multifaceted PCOS is, right? Yes. Like it's not just a hormone thing. It's, a metabolic thing. It's right. Like it's got almost every component of health that you can imagine. Yes. And so with that, one of the biggest things that, I look at, and I'm sure you do too, is the thyroid in individuals coming with PCOS. So I was just wondering if you could speak a little bit to that and how important it is to integrate that as well into the PCOS case. Yeah.
Absolutely. And so I should clarify that when a patient is going through their fertility workup, whether they're working exclusively with me or whether they're, part of the integrated model and are working with the medical doctor as well, the thyroid is always assessed. And that's because certain elements of, thyroid dysfunction can mimic certain components of PCOS when we look at things like, difficulty managing weight, or if we're looking at things like impact on the hair. And what's interesting as well is that, the insulin resistance that's often present with PCOS can actually increase the risk of elevated thyroid antibodies and subsequent thyroid dysfunction. So that's always part of our workup so that we make sure we're not missing a really key piece of the puzzle. And in a lot of cases, we are managing both a thyroid condition along with PCOS.
Yeah. I just wanted to mention that because, we think about sex hormones so much, estrogen and progesterone, that we sort of forget all the other hormones at play. So thank you for that.
I never forget about the thyroid. Just didn't mention it today until you brought it up. So I'm glad you did.
It's such a little organ, but so important. So, well, with that, I do want to thank you, Dr. Rachel, for taking the time to walk us through that presentation and all that useful information, and just bringing hope and clarity to people who might be navigating this wherever they are in their journey. If you want to learn more about Dr. Rachel, you can find her on Instagram, but also on her practitioner profile on Health Buddha. You can follow us at Health Buddha Can on Instagram, which will keep you updated with all the information around upcoming webinars and practitioners, and who you can connect with to support your health journey. So thank you for joining in, and thank you again, Dr. Rachel, for being here.
You're most welcome. Thanks so much for having me.